cameras off if you like. Good morning. Good morning, everyone. My name is Danielle Clemens. I'm with the New Jersey Department of Health, Youth Camp Safety, and Public Recreating Projects. I am here to present our Youth Camp Compliance 101 training that talks about the New Jersey Safety Code NJAC 8:25. I thank you all for joining us. I'm going to give it a little bit of time to allow others to come into the room, get settled before we start the presentations. I think we might be doing pretty good as far as participation. Expecting about 300 folks to participate. So again, if you're joining us this morning, you're joining us for the Youth Camp Compliance 101 training on New Jersey's Safety Code NJAC 8:25. If you have any questions or concerns, please use the chat to do so. So I'm just about to go ahead and get started. Again, good morning. My name is Danielle Clemens. I'm with the New Jersey Department of Health, Youth Camp Safety, and Public Recreating Projects. We're glad that you can join us this morning and to prepare for the upcoming season of youth camps. We're going to be reviewing key responsibilities, updates, and best practices relevant to youth camp operators. This webinar is designed for youth camp operators and staff. Before we begin, just a few housekeeping items. Please ensure that your lines are muted to avoid any background noise during the presentations. To submit any questions, you want to use the Q&A section located at the bottom of your screen. Our speakers will respond in the chat throughout the session. For any questions we are unable to address during the webinar, we will prepare a FAQ document and share it with all attendees afterwards. The video of this recording will still be available in the Teams chat. Please note, the session is being recorded. This training is intended solely for camp operators, owners, and staff. So we have a full and informative agenda ahead. I thank you again for your time and participation. So let's get started. Janelle, if you could share the DFD PowerPoint slide presentation. And we have our first presenters with the Department of Human Services Child Care Assistance Program, Cynthia Edmonds and Tyler Ebersberger. Tyler, please forgive me for butchering your name. You guys will be talking about the Child Care Development Block Grant. Are you guys available?
I'm ready.
All right, perfect.
Okay, well, good morning, everyone. Before we start and begin to get into the slides, just to kind of give you a little quick background. So I will be discussing providers who plan to serve families who are participating in the NJ Child Care Assistance Program. So that would be your CCR&Rs, like your 4 Cs of Union, Passaic, your Rutgers, Community Child Care Solutions, Program for Parents, the other 14, 15 CCR&Rs that we have. So this is just specifically if you plan to accept children who have or approve for NJCCAP funding. Okay, you can advance the slide. Thank you. Okay, so DFD and Child Care and Development Block Grant, CCDBG requirements. To be eligible to receive public funding, financial assistance, or grants, just to let you know, we will not have any grants for so far as of today at 9:37 a.m. There is no grants for youth camps this year. Okay, so you must meet CCDBG federal law requirements, which is to be licensed, regulated, or registered, comply with local and state building, fire, and health codes, complete pre-service basic health and safety training requirements, complete and satisfy comprehensive criminal background checks, undergo an annual unannounced inspection. Next. Okay, so here are some of the CCDBG health and safety training requirements for new staff, right? So we have the health and safety, child care growth and development, and mandated child abuse and neglected reporting. It's a mouthful. Basic requirements for license, which is the 10-hour module overview of the required CCDBG health and safety topics. Then we have pediatric first aid and pediatric CPR training, right? So this is the training, not certification, training. Then, important note, staff and providers also must comply with all Department of Health requirements and regulations. So for more information on trainings, you can go to our website at childcarenj.gov and /provider/training. Okay, now for existing staff, right? So this is staff who's returning back this year for the 2025 season. All returning staff members must complete 4 hours of annual in-service training, consistent of the mandatory health and safety and child growth and development refresher training, which is 2 hours. And with that combination, you can use maybe your facility or your youth camp offers a pre-service orientation training offered by your youth camp director or administrator, which can be 2 hours. Or you can visit the New Jersey Workforce Registry and find a professional development training to cover the additional 2 hours. Right? And just, I didn't note last time, trainings are free through the New Jersey Child Care Information System. So all staff members should have a Workforce Registry account, and you can access trainings through NJCCIS. Sorry. Next slide. Okay. So we giving you some additional trainings that you may want to look at, right? So this is what's currently available in NJCCIS. So we have the school age child development part 1 and 2, that's 3 hours. Then we have the child abuse and neglect and mandated reporting refresher, that's 1 hour. Again, these courses are offered through the New Jersey Workforce Registration and NJCCIS through the Learning Management System, which is LMS, right? All completed training certificates must be uploaded to your professional development and certifications profile in NJCCIS for Workforce Registry verification. So this is in case you may have take the trainings in person outside of NJCCIS and you receive the certifications. You would upload them to your personal Workforce Registry or your NJCCIS accounts. So to upload the certificate so you can get credit through the Workforce Registry. Next. Okay, So I'm going to hand this over to my colleague, Tyler Ebbsberger. He's going to discuss the criminal background checks and overview. Thank you.
All right, good morning. My name is Tyler Ebersberger, and I'll be going over the criminal background checks portion of this presentation. All right, so the comprehensive criminal background checks are completed by a few different partner agencies of ours. First, we have the Department of Human Services, which is we are under, um, and the Employee Controls and Compliance Unit performs the criminal history and the sex offender registry checks through the fingerprint process. Um, they're required for all current and prospective employees and volunteers, regardless of age, and individuals who have unsupervised access of children in care. This is an important note to be aware of, as this is a change from last year. That it's required for all current and prospective employees and volunteers, regardless of age. So please do take note of that. Um, Next partner we have is Department of Children and Families. They conduct the carrier or the child abuse record information check, which is in-state and out-of-state checks, and they are managed through the Office of Legal Affairs. They're required again for all current and prospective employees age 14 and older, including volunteers and individuals who have unsupervised access of children in care. And again, just a reminder, these checks are completed on an NJ, like in-state level and out-of-state level, so it'll check other states around us, and at a federal level. So they're very, very comprehensive background checks. All right, so the requirements for the criminal background check, if you're looking to participate in the CCAP program or Child Care Assistance Program, you must have an approved form of identification. Oh, I'm sorry, if you're looking to be fingerprinted, for staff being fingerprinted, this is the requirement. So you must have an approved form of identification, and IDEMIA, the fingerprint form that you'll have, will have a list of approved documents that applicants can bring. They must be fingerprinted for the specific camp program the applicant is working in. So you'll know that by your camp ID. They have to be fingerprinted for your specific camp. They're not transferable between camp programs. And camp volunteers must be fingerprinted every year that they come back. Camp employees must be re-fingerprinted every 5 years, or if there is at least one season break in employment. So I can explain that a little bit further. Um, so for the one season break in employment, that simply means that if you have an employee who came 1 year, then skipped the one summer, and then coming back again for the third year, they would have to go back out and get fingerprinted. If the employee is continuously employed summer after summer after summer, and you maintain the fingerprint results on file, then they do not have to be fingerprinted until that 5 year mark hits. All right, so this is the IDEMIA fingerprint form that was referenced in the previous slide. And again, there's the red box there showing that this is a new addition to the form that you'll see. And this is because individuals under 18 are to be fingerprinted now. So there'll be a section there that'll let them know what identification they can bring or how to get that completed. All right, so registration NJCCS for CCDBG. These are a few steps you must take. So associate the youth camp director with the facilities profiled NJCCIS. Complete the youth camp acknowledgement form, which will be found on the program's information page. Upload your most recent W-9 to your profile's file cabinet. It's important that it's the most recent one and not a older form, as that will um, hinder banking actions. And then you need to complete all required CCDBG health and safety requirements that are put out by CCDBG.
Okay, I'm going to talk a little bit about the e-child care provider web portal. So you should be familiar with this. And if you don't have like your it's called the eChild Care or Epic ID. You can reach out to your local CCRNR. So your eChild Care web provider web portal would kind of or will show you all of your families who are participating in the CCAP program. It will show you your contracts. It will show you the daily rate. It would show you if it's full time or part time. It would also show you your payments, and it would process enrollment based payments, right? So that's where you can go and you can check the portal on a biweekly basis to see who you got paid for, who you didn't get paid for, what contracts are currently in the system. Okay, new this year for youth camps. Back in 2023, we mandated all provider types to complete what is called the NJCCAP attendance calendar. This calendar is available through the eChildcare web portal where you can log in. It's not in real time. It's like a month, like 6 weeks behind, and you report all of the closings, closures, and the absences for the children, right? Um, Failure to complete the NJC CAP calendar may impact the provider's New Jersey CCAP funding. Now, as far as this, we will have in June, July, we will have TA sessions, lunchtime and evening to train providers who are participating in the CCAP funding how to utilize the calendar. So don't worry about that. We'll have plenty of office sessions, TA sessions to get you caught up on that. And it's very simple. Next slide, please. Okay, so here's some youth camp guidance tools, right? So you can go to NJCCIS at the help page, and there's a section where you scroll down to DFD, Division of Family Development, and there's a bunch of how-to videos and documents. Then also you can go to our website, childcarenj.gov, and you can find your local CCR&R if you have questions about Youth Camp CCDBG registration. I also want to just mention one last thing. So right now, if you are a camp and you're looking to participate in the Child Care Assistance Program and you log in into NJCCIS, you will see that all of your profiles are inactive. We have not activated any youth camp profiles in the state of New Jersey. We are planning to do this as part of the registration, and within the next week or two, we will send out email blasts to all youth camps who have either said that they plan to participate in the Child Care Assistance Program on their CB11, which is the DOH Youth Camp Certification application, or the ones who participated last year who's already known to our system. So you would get an email blast saying your profile is now active. You can start going in and you can start with that registration process, which is completing the acknowledgement form, going in to get your identical forms, to get, staff fingerprinted and things like that. Okay, so just to let you know, and just hold off on doing the acknowledgement form now because your profile is not active. So hold off for that for now, and we'll send you an email blast with more details, and we'll have upcoming TA sessions just to get all of the youth camps in the system, navigation, and things like that. And thank you for your time, and thank you for serving the families of New Jersey. Danielle, back to you. Sorry, one last slide. This is important websites and contact. This is just our general slide. And if you have any questions in particular about the Child Care Assistance Program, we are like the second one. You can email us, you can call us, send emails. We are here to help and assist you. Thank you again. Enjoy your summer.
Thank you so much, Sin. Janelle, if we can get that last slide back up one more time. We do receive so much information. First of all, we appreciate the Department of Human Services, Division of Family Development, for offering the Child Care Assistance Program. Again, this helps numerous families in New Jersey to afford childcare. It's an important program. We support the Department of Human Services in this endeavor to make childcare affordable to families in New Jersey. So we really appreciate this activity. So if you have questions about, the fingerprint form, carry checks, any of the requirements that are requirements of participation with the subsidy program, then you want to reach out to the Department of Human Services, which is dfd-youthcamps@dhs.nj.gov. They're the folks that can help you with those questions. Thank you again, Cynthia and Tyler. Appreciate your information. Now, moving on. Our second presenter will be, I'm sorry, I got a little confused. Okay, so next up we have the New Jersey Department of Health Communicable Disease Program with Nicole Lamb and Michelle Bove. They'll be here to talk about keeping your youth camps healthy. Nicole, are you ready?
Yes, I am. Whenever the slides.
Perfect. Thank you so much.
Thank you so much, Danielle. Hi, my name is Nicole Lamb. I am part of the Communicable Disease Service here at New Jersey Department of Health and part of the school health team. Myself and Michelle Bove, who is one of our health educators, will be talking about how to keep your youth camps healthy. So just a brief little basics. Communicable diseases in New Jersey. New Jersey Administrative Code 857 does require the reporting of specified communicable diseases and outbreaks. This regulation provides guidance on the reporting and investigation required for each listed disease and condition. We do have a link here. After I'm done talking, I will post links in the chat as well as our email address for any additional questions. Next slide, please. On the same communicable disease reporting page, you will find our quick reference list of reportable diseases. Reportable diseases are separated into two categories: immediately reportable diseases and diseases reportable within 24 hours of diagnosis. Outbreaks and suspected outbreaks of any illness, even if that illness is not listed here, for example, norovirus, are immediately reportable to your local health department. In fact, most of what we see in the school and youth camp setting are not illnesses or diseases that are reportable on their own. So who should report? Healthcare providers, medical facilities, veterinarians, daycare centers, preschools, youth camps, schools, and institutes of higher education are required to report. Healthcare providers, laboratories, report positive test results into our communicable disease surveillance system. So sometimes you may get a phone call from your local health department saying, hey, we have a resident here who was diagnosed with a reportable illness and they attend your youth camp, and they may be looking for a little bit more information. Next slide. So reporting outbreaks. As I mentioned earlier, outbreaks and suspected outbreaks are immediately reportable to the local health department where the camp is located. You're reporting to your local health department because communicable disease activities must be led by a licensed health officer. The authority to investigate and control communicable diseases is on a jurisdictional local health officer. If your local health department or health officer cannot be reached, you can call the New Jersey Department of Health at 609-826-5964 and 609-392-2020 after hours. And I can put this information in the chat as well. Sorry. Next slide. You may have to hit a few times because there's bullets that come up. I apologize. Thank you. One more or two more. Thanks. So who is your local health department? Your local health department is a partner to keep your attendees, students, and staff safe and protected. They serve as a guide for your facility during a suspected or confirmed outbreak and a resource for infectious disease concerns and updates. We do have a local health department directory. So if you're not sure who your local health department is, you can enter the address of your camp and the information will pop up of who to contact. Next slide. Here I want to highlight our updated outbreak guidance. It's new and improved with sections on outbreak prevention, cleaning and disinfection, and vector-borne disease prevention and activities that Michelle will go over. There's also a section for residential camps if that applies to your facility. This is the general guidelines for the prevention and control of outbreaks in camp settings. This document is developed to guide your local health department through outbreak investigations and has a lot of information inside. It also contains helpful information about how to prevent and control infectious disease spread in your camp. It has a dynamic table of contents, so you'll go directly to the section you're looking for. And again, I'll post a link directly to this in the chat once I'm done speaking. Next slide. You may have to hit it again. I apologize. Thanks. I wanted to give a general reminder to always report increases in illnesses to your local health department. As I mentioned, outbreaks and suspected outbreaks are immediately reportable, even if the individual cases of disease are not. Your local health department can help you differentiate between baseline illness and suspicious increases. Any increase that looks unusual to you, give your local health department a call, and they're there to help you determine whether or not you have an outbreak occurring. An outbreak is defined as an occurrence disease greater than expected at a specific time and place. Some key red flags to look out for are several children who exhibit similar symptoms in the same group or cabin, in the same wing of your facility, or if they attend a common event. If there is an increase in absences with parents reporting similar symptoms as the reason why their child is not attending camp. And of course, if you're in general, if you're notified of a highly infectious reportable disease, you should call your local health department for guidance, such as measles or bacterial meningitis. Next slide. What is your responsibility as a camp administrator during an infectious disease outbreak? Not only to report the outbreak as mentioned, but it is also your responsibility to provide routine updates to your local health department. Your local health department will guide you on how often an update is needed since not all outbreaks are the same. Communication is key, both with your local health department as well as parents before and during an outbreak. Any notifications about outbreaks or increases of illness that are sending home to your parents should be done in collaboration with your local health department. They're a great resource and can provide specific language to help you out. So reporting suspected outbreaks. When reporting a suspected outbreak, a few key pieces of information will be requested. First and foremost, your current camper and staff census, along with the number ill, will be requested. It is also helpful to know the number of groups or cohorts affected, such as all of grade 7, or if it's only in specific populations. When was the first illness reported? This can sometimes be difficult to determine, but giving the local health department a rough idea of when this outbreak could have potentially started is very helpful. It is also helpful to note when the most recent case became ill. Another key piece of information to give the local health department is any known diagnosis or laboratory test results. If no test results are given by parents, symptoms can be very helpful. It is typically the information we rely on, since most of what we see in camp is not reportable, so no testing has been done. Next slide. You may have to click again, I apologize. This is an example of our school or youth camp Excel line listing. Excel and Google Sheets for line listings are located on the school health page. Again, I'll link to that in a minute. This line list is meant to be used if an outbreak is suspected or identified. It's not meant to be an overall illness log for all reported illnesses. It is important to include as much information as possible for each individual student and staff, including any demographic information, the grade, the cohort or room number, the case role, such as if it is a student or staff, and all known symptoms. If you do have an onset date or a date when that illness started, that is also critical to include. If a symptom or onset date is not available, you can use the first date of absence. If any test results are provided, such as a parent says, my child tested positive for influenza, that's really helpful too. Next slide, please. This is an example of our exclusion list, which is included in our guidance document and is also available on our website as a standalone document as well. This list is updated regularly, and we have just updated it for this past year. So make sure you check the website to make sure you have the most updated version. It does give specific recommendations for school and daycare age children, as well as any type of food handler. So that will be specifically listed for each disease in there. I know I briefly mentioned notifications. Camps should have a policy in place prior to the camp year beginning for their notification to parents. How or will staff or parents receive the notifications? Some camps and some schools use messaging apps. Some just do email blasts. So that's something to keep in mind ahead of time before the camp season starts of how you're going to contact your parents. If there is an outbreak, who should receive the notification? If the outbreak's only in one classroom, you may only want to message that classroom in particular, or sometimes it may be a camp-wide notification. When to send the notification? Are you going to send a notification for one case, or if there's multiple cases? And what information to include about the specific illness? As a recommendation, we do suggest contacting your local health department before sending a notification. Your local health department may have already created templates and can really help with the specific language for the situation. So I always suggest contacting your local health department prior to sending out any notification regarding illnesses. Next slide. Here I just wanted to give you a brief overview of the past 5 years of outbreaks reported to New Jersey Department of Health for camps. That lovely light green is COVID-19 or novel coronavirus, and you'll see that in 2020 we had about 5 outbreaks reported, but that's because most youth camps were closed during that year. In 2021, we saw 45 COVID-19 outbreaks and no outbreaks of any other communicable disease. 2022, we saw about 25 COVID-19 outbreaks, 1 outbreak of hand, foot, and mouth disease, and 1 outbreak of gastroenteritis. 2023, we saw only 2 outbreaks reported altogether in youth camps throughout the entire state of New Jersey, including 1 outbreak of COVID-19 and 1 of hand, foot, and mouth disease. And then last year, we saw 5 youth camps or 5 outbreaks reported in youth camps, including 2 COVID-19 outbreaks, 1 outbreak of ringworm reported, and 1 other outbreak of gastroenteritis. So just wanted to give you a little bit of an idea of what we're seeing overall there. Just touching upon respiratory illness, last year, our guidance had changed for both schools, long-term care facilities, and we now have 1 combined respiratory virus outbreak guidance. So we no longer have COVID-specific guidance. All of these diseases, COVID-19, influenza, RSV, seasonal upper respiratory illnesses, share transmission, the same symptoms, and same preventative measures. As I mentioned, our guidance was updated in April of 2024, and the exclusion remains the same for all of these seasonal respiratory illnesses, as do all other public health measures. So you will not find that COVID-specific guidance. Next slide, please. This is that respiratory virus guidance. So we updated ours following CDC's change. Again, there is nothing specific for COVID-19. We do discuss the recommendations in terms of exclusion and return to school. So if someone has influenza, the same thing as COVID-19. And I just want to address this. Are COVID vaccinations required by the state for residential camps? No, they are not. Next slide. The other thing that I briefly wanted to touch upon, because it has been a hot topic as of lately, is measles. I know that we've been getting a lot of questions from schools regarding measles and what they can do in terms of prevention. So just wanted to briefly touch upon this in terms of preparing for measles. It's important to review the immunization status of all enrolled students and have documented proof of immunity or exemption to measles. Again, youth camps have the same immunization requirements as they do for schools in New Jersey. We want to encourage staff to confirm that they have documented proof of immunity to measles. It just makes your job a lot quicker if there is um, a case suspected or identified. You want to be able to be prepared to quickly identify and provide a list of children and staff without documented proof of immunity to measles in the event of a potential exposure. And again, as I mentioned before, establishing a relationship with your local health department is key. We do have a great document for measles preventing the spread in childcare and school settings, and this would be applicable to the youth camps as well. And I'll put a link to this in our chat. Next slide. We do have additional measles resources. We have a separate page on measles, which we have been updating with potential exposures and public notifications of, hey, you may have been exposed to measles during this time, and alerts on this. This is routinely updated by our vaccine preventable disease staff, and updated guidance documents do get posted to this regularly. So any updates, this is just a really great resource, and I'll again put a link to this in the chat. We also have a great FAQ document entitled Exposed to Measles. This would be for use when anyone has been exposed to measles, that goes to frequently asked questions and steps. And again, I can refer to that in the chat. Next slide. We do have a New Jersey Department of School health resources page, which all of this guidance does apply to youth camps as well. And I will put that in the chat as well, of just a link. This has links to our outbreak guidance, to those line lists, to specific situations such as fifth disease and influenza. So really quick, easy to use page, and I will put a link to that in the chat. We do have CDC school resources, preventing the spread of infections in the K-12 schools, which is also applicable to youth camps, the science brief, and CDC healthy schools. Again, CDC does not have COVID-specific guidance any longer, so you will not be able to find that if you are looking. They do have a general respiratory virus guidance page. So if you're trying to find it, it's going to be archived and we no longer link to that, but they do have other guidance out there that should be used, the general guidance. Next slide. And then lastly, and I think this is applicable to everyone, links messages. New Jersey Department of Health, and I know even Danielle's program uses it, sends out links messages about local and national outbreaks, CDC public health specific updates, trainings. We send out reminders about our guidance, any updates to our guidance to this as well. If you're not previously registered for links, I highly recommend it because it's how we communicate out to the public. So it is our health alert network, and we forward messages regularly and provide routine updates to that. We do have an email address for the CDS school health team. I will put that in the chat besides all the links. I am sorry for bombarding you, but this way you have, if you do have any questions that you think of later, please feel free to reach out. And with that, I am going to hand it over to Michelle to talk about vector-borne education for camps.
Thank you, Nicole, and good morning, everyone. So this portion is going to be brief. I just wanted to let you all know some vector-borne education materials that we have for camp specifically. The reason behind us doing this is because, you know, with camp, a lot of time is spent outdoors, which then puts you and the campers and everyone else at increased risk for vector-borne illness, including illnesses spread by ticks and illnesses spread by mosquitoes. So we really just wanted to bring some education to that and teach the campers how to prevent that to the extent possible, the bites and the illnesses, of course. So there's 3 different components, and there's of course room for this toolkit to grow based on feedback and everything like that. So there's a flyer aimed at camp counselors, workers, and camp goers. That's just a higher level overview of how you can protect yourself and the campers from these tick and mosquito-borne illnesses at camp, and then also what to look out for. There's a flyer aimed at parents and guardians sending their children to camp, and it gives a before and after of what to do. So before you send your children to camp, and then after camp, what to be looking for. And then there's an activity sheet for younger campers to use for educational purposes. Next slide, please. I'm just going to walk you through the materials really quick. So all these materials are going to be found within the guidance as well as an evaluation, which I'll get to on the last slide. But on the left-hand side is the flyer for camp counselors and camp goers. Like I said, it's a more high level. It could be posted around camp. It could just be shared with campers. Whatever is desired. There's also activity tips on the bottom, just stuff to keep them busy. And on the right is the one that can be shared or handed out to parents. It could be shared, of course, electronically or print, whatever is preferred. So before camp, it talks about treating clothing with permethrin, using EPA-registered insect repellent, the proper clothing to wear, what to teach your children about tick and mosquito safety. And on the right-hand side are activities to do after camp, such as tick checks and looking for tick and mosquito bites, how to remove a tick if one is found attached, and how to monitor for symptoms and who to contact. So that's just a little more in depth. Next slide, please. And then this is the camper activity sheet. This is, of course, as you can see, geared towards younger campers to serve as like a rainy day activity for these campers, educate them on insect repellent, how to limit mosquito exposures, and to teach campers that both mosquitoes and ticks are a risk at camp and how to limit those bites. So as I mentioned, this is kind of geared towards the younger camp population, but of course, depending on uptake and desire, we could always do activity sheets for older campers if desired, or presentations for camp counselors and campers, depending on the level and what is wanted there. Next slide, please. And this brings me to the last part. We created a brief evaluation for those who use the tick and mosquito camp resources. So whether you've used it before or if after you use it this time, we really would appreciate the feedback on this evaluation. It also asks if there's any other desires you have, whether it be videos, presentations for counselors, as I mentioned, maybe presentations for campers and the younger population. So definitely hold on to this link, or you can scan it. It will also be embedded in the guidance with the rest of the materials, but we really do encourage use of these materials for our parents, camp counselors, and for the campers, just to really try to limit the amount of vector-borne diseases we see in New Jersey, and to try to keep everyone healthy to the extent possible and take all those prevention methods into consideration. Thank you.
Thank you guys so much. Nicole and Michelle, I appreciate all of the information you guys shared about the communicable disease program and initiatives you guys are addressing for this summer. Again, if you have questions, if you're a camp operator or camp staff and you have questions about communicable diseases, if your camp has an outbreak, you want to definitely contact your local health department. We'll also go over in this presentation, we'll go over the outbreak guidance from the Youth Camp Safety Project's perspective. But again, very timely information. If you have questions for the Communicable Disease Service, please forward your questions to them. I just want to remind folks on this call to, sorry, thought I was sharing my screen, to please put your questions in the Q&A section. The Q&A section is the way that we can monitor what questions come in, and we can develop the FAQ and respond to any questions that we can't get to during this presentation. So if you have questions, please, again, add them to the Q&A. I appreciate all the questions we've seen so far. Thank you to our team and Janelle for your hard work processing applications, as well as helping to facilitate this webinar. All right, so the next up is myself. I will be talking about the Youth Camp Safety Project, what we do here, and etc. Let's see. I'm going to ask Janelle for her help. What are you guys seeing on your end?
Your the overall PowerPoint screen.
Perfect. Okay, let me try to make this into Okay, seeing the same thing?
Yep, we just see the slides.
Fantastic. Just 1 second. Actually, let me do one more thing. Okay. All right, you just see the slides now?
No, we see your PowerPoint screen of the homepage of the file.
So frustrating. Okay.
Okay, now we just see the slides.
Sounds good. Same?
Yep, only slides.
Okay. So again, my name is Danielle Clemens. I'm with the New Jersey Department of Health, Youth Camp Safety, and Public Recreational Bathing Projects. I coordinate both projects. Anne and Janelle are administrative folks. They process your applications as they come in. They also provide guidance or answers to your questions when you send us information in our youth camps email. For myself, I've been in public service for about 16 years. The last 7 of these years have been in this particular role as the coordinator for these 2 different projects. I've been in the field. I've been an enforcement officer, so I'm really familiar with these rules. And prior to taking this role in 2018, that was my role, doing enforcement activities in the field. So if you guys have, questions, either technical questions about what happens in the field or, questions about how this rule evolves, is revised, etc., you can always feel free to ask me. So at the Department of Health, Youth Camp Safety Project, we lead strategically through data-driven policymaking. I rely not only on national data, but also on local and county level data about injuries and illnesses that occur in the youth camp setting. Motor vehicle crashes cause more deaths than any other causes of an unintentional injury for children. Overall, unintentional injury death rates in rural areas were higher than metro and urban areas. So why do we do this work? We do this work to reduce the incidence of injury and illness among youth attending camps over the summer and other out-of-school times. When you think about the Youth Camp Safety Project, we have specific goals, which are to ensure the health and safety of children attending summer youth camps. And we do that through education and awareness and inspection and enforcement. Again, we are an inspection and enforcement authority. We utilize the Youth Camp Safety Standards, NJAC 8:25, to oversee and conduct enforcement activities at youth camps. But we also understand that, overall, where's a place that focuses on building character skills and traits such as gratitude, kindness, creativity, curiosity, perseverance, resiliency, empathy, courage, and teamwork. That place is often the summer youth camp. Camp is about fostering a healthy and safe environment where every camper feels valued, accepted, and celebrated for who they are. In a world that often emphasizes differences, camps can be a sanctuary where diversity is viewed as strength. You folks create awesome learning environments and spaces filled with energy, creativity, and foster community and exploration. We value that here at the Youth Camp Safety Project. Our campers forge new friendships. They get to know a little bit more about themselves, and all of this happens in the environments that you cultivate. So I thank you for all of your hard work in creating safe spaces for the campers of New Jersey. On your side, you actively develop and implement, summer camp programs On our side, we actively try to ensure that these environments you create are safe and don't lead to increased illness and injury among your summer camp populations. As I mentioned, we utilize the rule NJAC 8:25 to oversee youth camp operations. The purpose of the regulation is to ensure safe and reduce injury and illness among campers within the state of New Jersey. The role of the Youth Camp Safety Program is an enforcement agency. And again, we're responsible for conducting safety inspections of registered youth camps. We also provide guidance to camp operators to ensure compliance with established standards. Our primary goal is to reduce the risk of injury and illness among campers and the broader camp community. We do this through, again, education and raising awareness. Distinction between licensed and unlicensed programs. I want to make sure that you understand that it's important to understand that not all programs operating in New Jersey are required to be licensed as youth camps. Some may already be covered under another type of license or operate under different regulatory frameworks. For example, municipally run camps and licensed childcare centers are two types of entities that are not required to register as youth camps. Though they are encouraged to do so when appropriate, if you are a licensed childcare center, please reach out to your Office of Licensing Inspector to inquire about if the youth camp license will be necessary in your case. Additionally, some programs just don't meet the criteria for licensure, and in that case, they don't have to license. So let's go over camp licensing requirements. To meet licensing criteria, a program must, 1, include at least one high-risk activity. Some examples are swimming, rock climbing, zip lining, horseback riding, archery, sports, animal farms, or similar activities. They must operate for 2 or more consecutive days during the week. They must run for a minimum of 3 hours per day. And they have to serve 5 or more children under the age of 18 in recreational or educational activities. Actually, before I advance to that slide, one thing I want to mention is camps cannot operate in a residential or in an established residential home. So I don't think that I've mentioned that anywhere in our slide deck, and now that it's at the top of my brain, I just want to make sure that you're not operating out of your homes. So what's a high-risk activity? High-risk activity is any recreational activity that exposes the camper to a significant risk of serious injury or illness due to the inherent hazards associated with that activity. Examples include, but are not limited to, horseback riding, rock climbing, zip lining, riflery, contact or intense sports, aquatic activities like swimming or boating. Some of these examples are listed specifically in the rule, which means that you absolutely have to register your camp as a youth camp. Some activities are not listed in the rule. Some of you will remember back to 2020 when COVID-19 was running rampant, or I'm sorry, 2021 when camps were able to operate. COVID was running rampant, and we knew the mode of transmission. And singing had been identified as a high-risk activity. It was identified as a high-risk activity because we understood the mode of transmission. So keeping in mind what is happening during the operation of a youth camp could elevate some activities as high risk. Singing is currently not listed as high risk activity, just FYI. The licensing process overview. Renewal applications should be submitted pursuant the rule by May 1st. New applications should ideally be submitted at least 60 days prior to opening. The licensing process is rolling and continues to remain open, but the date associated with the renewal is to facilitate your pre-operational inspections that have to be conducted by your local health official for various reasons. We'll talk about the pre-op later in this presentation. Camps must contact their local health department in the jurisdiction of where the camp is located to schedule the pre-operational inspection. Camps that are accredited by the American Camp Association do not need to schedule a pre-operational inspection. Youth camp staff to camper ratios. The under 8:25-3.20 through Q, you'll see that one adult assisted by a counselor is required for every 20 campers ages 5 to 17. For groups over 20 campers, add one staff member per additional 10 campers. Similarly, one adult assisted by a counselor is required for every 14 campers who are ages 2.5 to 4. For groups over 14 campers, you'll have to add one staff person for each additional 7 campers. Although the rule does allow for campers under the age of 2.5, we highly recommend that these campers are cared for under the Office of Licensing Child Care Regulation. The youth camp safety standards were not built for this population. And again, although the rule does allow for campers to be cared for who are under the age of 2.5, we highly recommend that those campers are cared for under the jurisdiction of the Office of Licensing. These staff to camper ratios apply to all activities, including off-site trips. It's important that you have a documentation of your procedure for conducting background checks. It should be written and the documents maintained for at least 3 years. Our recommendation for writing a procedure is to have the person who does the activity write step by step how the process is conducted. If you write down what you really do, when we have questions about the process, you're less likely to get tripped up or simply lie about the process and how it's done. Our goal is not to ding you for simple processes, but to identify gaps and communicate where your activity may need some improvement. Again, the staff hiring requirements are located pursuant NJAC 8:25-3.2. I think that's J through I. Our rule requires that criminal history name-based checks are required for all staff 18 and older. Returning staff may submit a notarized statement confirming no changes since their last check. Sex offender registry checks are also required for all staff annually that are 16 and older. Documentation of the background checks should be made available on site at the time of the inspection. And again, you want to maintain your documentation for at least 3 years, but up to 5 years. background check requirements. Camp operators must ensure that background checks are conducted using one of the following methods. You can get those background checks conducted through the New Jersey State Police. You can visit their website, or you can have a vendor that performs background checks covering the individual's state of residence and their county of residence. Or you can have a 50-state national database name check done on your staff. Fingerprint-based background checks are not required pursuant NJAC 8:25, the Youth Camp Safety Regulation, but are an acceptable form of verification. Again, these checks are a lot more comprehensive than the name-based checks currently required by the Youth Camp Safety Standards. If you are an organization that participates in the subsidy program run by the Department of Human Services, your requirements for background checks may differ. When you are participating with that program, you have to do background checks based on what they're requiring to be funded, which is different than what your licensing requirements are under the Youth Camp Safety Standards. The camp operator or director is responsible for evaluating whether a staff member's conduct, criminal or otherwise, disqualifies them from employment using the criteria outlined under H through L in the standards. What you want to do is establish a written procedure for how the staff screening process is conducted and create a list of disqualifying offenses to help guide those hiring decisions. Your procedure could include just a review of the cover letter and the resume, a screening phone call, an in-person interview, personal reference check, and review of the background check documentation. But that has to be written. Staff training. The regulation at 8:25-3.2D requires that camp operator or owner facilitate a staff orientation training. The staff orientation training has to include the following components. They have to review the personnel policies and procedures, job descriptions, staff disciplinary policies and procedures, camper disciplinary policies and procedures, basic principles of first aid and bloodborne pathogen information, camp emergency procedures, lost camper or lost swimmer policies and procedures, and emergency evacuation, active shooter, severe weather policies and procedures. In order to document or have verification of your staff training orientation that's required, we encourage you to create a document that identifies the date and time of the orientation, includes a list of attendees and an agenda with the training records, and retain any records for any written exams or certification trainings that are completed by the staff that attended. You might have to conduct multiple staff training orientations. As we know, throughout the season, you have staff turnover. If you have new staff, you must ensure that they receive the training as well. Anyone in your camp community can be a mandated reporter. It could be a staff, campers, yourself. The rule requires that anyone who has reason to believe that a camper has been or is being subject to corporal punishment, abusive language, harsh or humiliating treatment, or any kind of child abuse should report it by calling 1-877-NJ-ABUSE. So let's talk about staff roles in the youth camp setting. Varied types of roles in the youth camp setting. The camp director must be at least 21 and have administrative experience in the youth camp setting. The health director must be an adult, at least 18 years of age. We'll go more in depth into the health director role and the credentials they're required to have later in this presentation. An adult camp counselor would be, again, someone who was 18 and older. Minor camp counselor would be someone who was 16 and older. Lifeguard supervisor has to be at least an adult, 18 and older. Since 2020, we've experienced shortages in the availability of lifeguards. That said, the regulation, youth camp safety regulation, requires that lifeguards be at least 16 years of age. However, since 2021, we've allowed for lifeguards at least 15 years of age to staff youth camp setting. These 15-year-olds may not serve in a camp counselor role. However, credentialed lifeguards who may be as young as 15 are allowed to participate in the role of lifeguard within your youth camp. Again, they would not be able to hold a camp counselor role. They would just be able to be a lifeguard. The high-risk activity specialist, we will go more in depth into later in this presentation, but that person should be knowledgeable of the high-risk activities that your youth camp are participating in. In order to identify properly certified health director, lifeguard, lifeguard supervisor, the current recognized certifications document is available for your use. The youth camp website, located here, I'll drop the link in the chat, is available, and I've circled the recognized certification list so that you folks can identify properly credentialed folks to staff your youth camps. We update the list annually, and there is a section for pool and lake lifeguards, for health and CPR training, and the professional CPR training, which is required of all health directors. So the high-risk activity specialist is required pursuant 8:25-3.2N. The high-risk activity specialist must be someone who is knowledgeable about the techniques of the particular high-risk activity, and they must have some type of experience with that particular activity. Documentation that you can maintain about the high-risk activity specialist is an up-to-date list of the high-risk activities conducted by your youth camp. So if you participate in swimming, you want to list that. If you participate in horseback riding, intense sports, sometimes, again, soccer, you can have flag football, all of these things that where incidental contact could happen, they would be considered high-risk activities, and you would want to list them. The health director. This health director is the person who oversees your health program at your youth camp. If you think about a school, the school has like a school nurse or a school, health person. This person is knowledgeable about the rules identified under subsection 5, which is the health section. They have additional training in how to address, injuries, basic injuries for a day camp person, and more extensive injuries for a resident person. So the health director requirements for day camp, the health director must be an adult and they have to be certified in basic levels first aid. The health director for a resident camp has to be either a registered nurse or licensed practical nurse, a licensed physician, a board certified athletic trainer, or an EMS paramedic, or someone certified in advanced first aid, or a first responder. The health director, both at a day camp and at resident camps, have additional requirements. The health director must be on site at all times. To address this requirement, we recommend that your camp have multiple folks certified so that they can step in and fill the role of the health director at all times. Again, you have illnesses at youth camps. You have people that just up and quit. There's many types of situations wherein having, a backup person or a couple of backup people would be extremely useful. I say this and stress this because this requirement of having a health director on site at all times is the biggest violation, or the most reported violation that we observe in the youth camp setting. The professional level CPR certification is required of both day and resident camp health directors. The health director at a camp may not serve as the health director. The camp director may not serve as the health director if more than 50 campers are receiving care on site at the time. So you have 51 kids show up on a day. Your camp director and your health director must be two separate people. Lifeguards may not perform other duties while actively serving as a lifeguard. So the lifeguard is a role that this individual or the person in this role is certified in advanced level CPR. They also have professional level advanced level first aid, and they also have the professional level CPR, which would be adult, child, and infant level CPR. Because a lifeguard would qualify to be a health director at either a day or a resident camp, this person or this person filling the role, it's important to realize that they cannot serve in the lifeguard role and as the health director concurrently. Staff roster. It's important to develop a staff roster. It helps with ensuring that you have the staff necessary to care for the amount of children that your camp is hosting. It also helps in addressing any outbreak concerns that may arise during your summer youth camp operations over the summer. The staff roster, having your camp roster, again, it really helps us to hone in on who could potentially be implicated in an outbreak. So what you want to do is develop and maintain a staff roster. You want to have the full name and the role of the person, whether it's a counselor, a volunteer, You also want to indicate the date of the hire and any completed trainings that this person has gone through. You want to have the background check status, whether they completed, whether it was reviewed, the sex offender registry check, making sure that that information is current and on file, and any relevant credentials, such as any first aid credential or CPR certifications. Inspection and enforcement. Your pre-operational inspections are conducted by the local health authority located in the town where your youth camp is being operated. They must be conducted before campers are on site. The camp operator is responsible for reaching out to the local health department at least 3 weeks prior to opening so that they can schedule you to conduct the pre-operational inspection. The inspection must be performed by the local health authority in the camp's operating jurisdiction. And generally, these inspections include a desk audit of your policies and procedures and a site visit, if available, to verify the suitability of the location. Why this matters. The site visit is important. One, because you want to make sure that that you can operate where you have identified your camp location. So some jurisdictions, some local health jurisdictions require, let's say, you're operating on the beach. You must contact that local health official, local health department, to ensure that you're able to operate on the beach. And taking those steps in arranging the pre-operational inspection helps in ensuring that the local health department knows where you are and you know who your local health department is in the case, in event of an outbreak of illness or disease. The operational inspections are conducted by our office, the NJDOH Youth Camp Safety Project. We are also the licensing authority. We're the folks who issue and provide your licenses. So the pre-operational inspections are done prior to your operation, but the operational inspections conducted by our office are unannounced and unscheduled inspections. They may be triggered by complaints, are conducted as part of a routine oversight. They occur during the camp season while the campers are present on site, and we focus on verifying the implementation and compliance with the standards, NJAC 8:25 Youth Camp Safety Standards. Part of the verification processes include ensuring that your camp is staffing, your staff to camper ratios are adequate. We review your background checks and your sex offender registry checks for all staff or a portion thereof. We review policies and procedures implemented across all areas of your youth camp. We review health center records, including documentation of credentialed health director and that they're on site. And also the illness log, immunization records, and proper medication storage and administration. We also look over the food service and storage practices. We verify that the site is identified or located in a safe space, marked or delineated so that we know where your camp starts and ends. We review on-site waterfront activities and any required documentation for on-site waterfront activities, like if your camp has a pool or has access to a beach, we review that information, as well as your transportation vehicle documentation. Additionally, as mentioned before, we verify compliance with the Department of Human Services Child Care Subsidy Program requirements, only for the camps that participate in their program. Again, this could be minimally like your fingerprint checks, your training requirements for that program, and other program requirements that they ask for us to look over. So again, only if you're participating with the Child Care Subsidy Program does that additional piece of enforcement take place. Youth camp operators who are in violation of any provision of the Act or this chapter, NJAC 8:25, youth camp safety standards, may have their certificates of approval revoked and may assess a civil administrative penalty of $1,000 per day upon notice and hearing. So let me go over a couple of frequently asked questions. If I own a youth camp site and rent out the space for various summer programs to use, am I required to license? The answer to that is no. If you own a campsite, you aren't gathering the children together for a youth camp activity. It is not your responsibility to license. However, it is the responsibility of the camp operator who is bringing the kids to have a youth camp license. Is singing a high-risk activity? No. Singing was a high-risk activity during the height of COVID. However, at this time, singing is not considered a high-risk activity. Therefore, if singing is your only high-risk activity, you do not need to license. Again, if singing is your only high-risk activity, you don't need to license. What if I don't have a high-risk activity? Do I need to license? No. If you do not have a high-risk activity, you do not need to license. You may want to contact us to ensure that the activities at your camp do not constitute a high-risk activity. So how to submit a license application? First, you must download the CB11 Youth Camp Operation Application Form. Secondly, you'll need to make payment. Third, you need to complete all the form fields, including the payment section on the application form, and then email the payment receipt and application form to our youth.camps@doh.nj.gov. So, because we have this question so much, I want to actually go through our website to help you in your process of applying. Okay, so Janelle, can you tell me what you're seeing?
Yeah, we see the CB11 form.
See the CB11.
Now we see the SharePoint.
Perfect. Okay. So I'm going to Google New Jersey youth camps. Click the link for our website, and it brings me to our website. Janelle, are you seeing our website?
No, we're still on the SharePoint screen.
Maybe I'm moving too fast.
Now it's loading. Now we're on Google, and now it's the youth camps. Sorry, it took a bit to load.
Okay, no worries. I appreciate you. So once we're on our website, we're going to go to apply or renew a permit. Click that link. We have a bit of information about applying prior to you even downloading the youth camp application. You want to go ahead and download the youth camp application. Janelle, are we on the CB11 form?
Yes.
Fantastic. Okay. Again, you want to download the application. If you don't download it and you fill it out here in the web browser, any information that you enter into this form will disappear. So you need to download the form before you can actually complete any information. Here I've downloaded it and I've saved it to my downloads folder. All right, a couple of other things about the Youth Camp form. Again, once you download, go to the folder, open the document and complete the information. All right, couple of other things about the few things of note, which is download and save the application to your hard drive. Forms completed in the browser will not retain the information you input, so you need to save the form. Another tip is to use Adobe Reader when you're filling out the application, because our computers, our systems are optimized for that program. When you don't use it, some things could be missing on your application form. Next, the site location field. Let me go to it. Site location address. Here, that is for the site location of your youth camp. Oftentimes, we're receiving application forms with the site location being the local health department's address. That helps no one. We need the site location for where you plan to operate your youth camp over the summer. Please do not put your local health department's address there. We know that, just like you do. The link here for your local health department directory is so that you can identify which local health department is responsible for your pre-operational inspection. Lastly, let's see what else. Our internal firewalls reject foreign unknown links. In fact, sometimes those emails containing links are not even delivered. So please do not send any links to Google Drive or Gmail for your application or showing proof that you paid. This is a cause for security reasons. This is because of security reasons that we in our office are not able to access outside links. Okay, now I'm just going to share my PowerPoint presentation again. Jadelle, are we back?
Right now we see the CB11 form.
Let me know when we're.
We see it, but with the notes.
Okay, so let me put that. Okay, we back?
Yes, just the slides.
Okay. Still slides or notes too?
Only the slides.
Fantastic. All right. Okay, so the CB11A form is obsolete. It was a form that we developed during the height of the pandemic because during that time, camps were not allowed to leave their site locations. The form is no longer used because now you folks can take field trips again. So please do not use the CB11A or CB14A forms to submit your youth camp information. You must use the CB11 or CB14 forms to submit your applications. Last year, we implemented the use of a new database that caused application processing delays. However, this year, the new database, along with additional processing staff, is facilitating faster turnaround times for your applications. Generally takes about 1 to 2 weeks for your application to be processed. Please check your spam folders for our emails containing your license, and to make sure that your emails containing your license was not routed to the wrong place. When you receive your license, please open the email and check the information on your license to ensure that it is correct. If it is not, reply to the email and specify the information that needs to be corrected. Okay, so now we're going to go more so into the rules. I'm going to talk about the rules which are going to be enforced in 2025. The same rules that have been enforced for the last 10, 15 plus years are still in force now. The rule was revised. However, the changes that were indicated do not take effect until 2026. What we will do is offer a training in the fall of 2025 to discuss any changes that impact your operations in the youth camp safety standards. I also think it's important to note that written policies and procedures that are required by the youth camp safety standards should be easily accessible in one place, in a binder or a book. Electronic records are also acceptable forms of documentation. What you want to make sure is that your staff on site at the youth camp has access to any electronic records that you have. If an enforcement official arrives asking for the documentation, the person in charge, who you designated as the camp director or whomever is in charge, must participate in the youth camp inspection process. The more organized and accessible your documents is often directly associated with how efficient our inspectors can review your policies, corresponding activities, and conclude your unannounced compliance inspection activities in a timely fashion. Again, the youth camp regulation requires that camp staff participate in a camp orientation training. Emergency procedures and health center concerns are part of that training requirement. You also want to talk about the mandated reporting of child abuse or suspected child abuse. Staff supervision requirements are identified here. I've also included the specific provision that allows for campers age 5 to 17, that again, they're one adult assisted by a counselor who is at least 16 for each group of 20 campers. Each additional 10 campers requires one additional staff. For campers 2.5 to 4, one adult assisted by a counselor for each group of 14. Each additional 7 campers requires one additional staff. And lastly, campers from birth to 2.5, one adult assisted by a counselor for each group of 8 campers. Each additional 4 campers requires one additional staff. You want to discuss with your personnel how to handle and the policies and procedures for children that need to go to the restroom or to the health center, or any situations where a camper needs to break apart from the larger group. You want to discuss how those activities are handled. Your policies may also want to include how your staff communicate about the whereabouts of kids. Are you using radios or CBs or whatever? How are you requiring your staff to communicate when they're in different spaces? So a couple of frequently asked questions regarding staff supervision requirements. How many children can my youth camp accommodate? Your youth camp can accommodate as many children as you have staff in adequate number to maintain the supervision ratios identified by the standards. Can I have all of my campers in one gymnasium? Within buildings, most buildings have a capacity located in the room. So you want to maintain the ratios or the capacity requirements of the building that you're being housed in. Can my youth camp operate in a park without a building? Yes. Youth camp safety standards allows for camp activities to be hosted anywhere. They can be in the forest. They can be at a park. They can be on a beach. But again, you must receive your local health jurisdictions okay to operate on the beach or in the park. If your jurisdiction oversees those activities, not all jurisdictions will require you to, get prior authorization to use that space. However, you must check. So the youth camp site requirements. The site location must not present a fire, health, or safety hazard. It may not be located in a private occupied residence. It must not be located wherein a highway or railroad or other traffic could endanger the children. Hazardous areas must be guarded or fenced off. Signs posted to reduce the potential of harm. Subsection 4 details requirements of resident camps, sleeping quarters. We probably have about 100, maybe 110 residential camps operating throughout the summer. This small population. So if you have specific resident camp questions, please email us at youth.camps@doh.nj.gov. If you are operating your youth camp within a building, you're required to have the certificate of occupancy or to reach out to your local health authority to receive approval to operate within that building. Most schools, the certificate of occupancy may not be available. But again, if that school is operating throughout the school year, 9 times out of 10, the certificate of occupancy is understood. Each youth camp must identify the health center, and this must be established, whether it is, physical or just theoretical. Let's say physical. What I mean by that is if you're operating within a building and you designate this particular room to your health center, then that is physically, we know exactly where it is. If you're in a park and you decide to designate this particular area for any health center concerns, then in that case, that's theoretical. We know that you must identify that, okay, this space will always be used for our health center activities. You want to have the health center supplies located in that space so that you know, or that your campers know, and that your staff knows where your health activities occur. The health center could be a tent. It could be a building. It must be located away from a kitchen or food preparation area. It also must be protected from weather elements, flies, and vermin. You have to have the medical equipment necessary, first aid kit to treat any illness or injury communicated by your campers or camp community. And you also must have a clean mattress and sheets for any camper or staff who needs respite and care for at least one mattress for the first 50 campers. Credentials for the health director. It differs depending on whether the camp is a day or resident camp. We talked about that a little bit earlier. Your dedicated health director must always be available when the camp is open and operating. The designated person has to be credentialed. And again, we recommend that you credential more than one staff member to fill the role of the health director. A telehealth physician would not talk to me if you're a resident camp and you have a telehealth physician. Please email me at youth.camps@doh.nj.gov. Camp director may not act in the role as the health director for camps serving over 50 campers that day. Part of the health program requires that daily health surveillance activities are conducted for campers on site. This could be a roll call, wherein, as your campers are arriving on site, you have, one or two staff members, checking them in, reviewing their physical health, making sure that, there are no bumps or bruises, or signs of illness that weren't present the day before. You want to maintain that documentation. Immunization records are also required to be stored and maintained on site. Again, having the immunization records available helps during the time of an outbreak, wherein you need to identify who has received immunizations for a particular concern and who has not. Those folks who have not received immunization should be restricted from attending the youth camp during the case of an active outbreak for that particular disease. You want to provide the health histories. Health histories meaning if a child has asthma or a child or staff member has a food allergy. The health histories for the campers and staff are required to be maintained on site so that you know if a child came into contact with a nut or peanuts and they have a nut allergy, then you know that some additional action needs to be taken. The parental and guardian consent to provide medical treatment is also required for camps that provide medical treatment. If your camp chooses not to administer medication, you must indicate that on the camp brochure to let parents know and give them the foresight that your camp does not administer medication, and they can then make their choice depending on your administration of medication or not. The policies and procedures for the administration of medication have to be maintained on site. A medical log maintained for the campers and staff who visit the medical center is required to be maintained on site. Generally, this medical log could be, a document that identifies the date, the name of the camper, the concern that they came in for, and what activities were administered during their visit to the health center. It helps you to identify, as the camp director, any trends. If there are multiple people presenting to the health center with gastro issues, or folks out ill with gastro issues. So it helps you to identify concerns of communicable disease a lot faster and easier, which is why the requirement is there. You must have written policies and procedures for treatment and escalation of various health conditions. When an injury or illness, actions should be taken, or if that illness or injury should be escalated to off-site care. When you should contact your parents about a concern, and when you are notifying the health department or the licensing authority about a concern. Outbreaks must be communicated to your local health department immediately. They must also be communicated to your licensing authority, the NJDOH Youth Camp Safety Project, within 24 hours. You can email us or you can call us at the numbers listed below. Serious injuries, head, neck, spinal cord, camper unconsciousness, and or death must be communicated to the Youth Camp Safety Project immediately. You can email us or contact us at the number listed below. Safety considerations. Again, policy and procedure is important. You must have written policies and procedures for evacuation, any natural disaster response, active shooter response, and parent communication and reunification plan. Fire safety activities, working smoke detectors, fire extinguishers to ensure that you're notified or you can identify a concern in a building if a building is existing. Other safety concerns, cones or delineation tape, something that you can, if you're operating in a park or outdoors, you want to definitely have something marking and delineating your site location. Water at the youth camp must be potable, which means it must be of drinkable quality. Well water must be tested. If you are serviced by a well, that's one of the questions on the application form. If your site is serviced by a well, you must ensure that the well is tested. If you are not the owner of the site and you're renting the site, then reach out to the owner and receive the most recent testing records for the well that services the site. Any food preparation activities are inspected in congruence with the retail food law. And we showed this picture earlier in the day, talking about unintentional injury and deaths for children. And again, this is why we do this work. Preventing heat-related illness is absolutely important and a goal of the Youth Camp Safety Project. We have these resources available on our website, which help you to understand either heat-related illness signs and symptoms and what things you can do to protect your campers from heat-related illness. Similarly, we also have information on our website about the air quality flag program. which is run by the NJDEP, Department of Environmental Protection. The flag program essentially is a notification system wherein if you sign up to participate in the air quality flag program, the DEP will notify you about the air quality in the location where you're operating your youth camp. You would just need to click this link. I'll share it in the chat at the conclusion of this presentation. Injuries and illness among children. Drowning is the leading cause of death in injury for children aged 1 to 4. Motor vehicle crashes, second leading cause among children aged 5 to 19. That said, transportation programs are a piece of the enforcement activities conducted by our inspectors in the field during your youth camp inspection processes. Vehicles used to transport campers must be inspected by the school bus inspection unit. Their link is available on our website. If you use a charter bus, the company should be in congruence with the MVC rules. Those charter buses do not have to be inspected by the school bus inspection unit. Drivers of vehicles that transport campers are required to possess a CDL license. That particular requirement is identified under the Motor Vehicles Commission's regulation for the operation and transport of school kids and campers. So you will need to contact the school bus unit in order to talk to them about the CDL requirement. That is not a requirement. It's not a provision that is listed under the youth camp safety standards. It is a requirement of the Motor Vehicles Commission. Caveat, we have reached out to the Motor Vehicles Commission because we have identified or noticed a rise in youth camp operators not using school buses to transport kids. However, the requirement for the CDL remains. So we're continuing in ongoing talks over the last 2 years to address the CDL difference. If you are driving a van to transport your youth campers, again, still contact the school bus inspection unit. If our enforcement inspectors come to your youth camp to verify that your drivers obtain or have maintained a CDL, the condition will be noted on your report. However, we still know that there's a bit of disconnect between our two rules, and we're working on finding a fix. Vehicle conveyances are required to have up-to-date and documented insurance. They must have established written policy for the discharge of campers to their parent or guardian. Evacuation drills must be conducted at least monthly. And any other record keeping, like the driver's licenses, insurance documentation, transportation locations, name and contract for any contracted bus services, like a charter bus. All of that documentation should be available on site. Waterfront program requirements. I want to talk first about on-site waterfront activities. If you have a lakefront or a pool or any other waterfront activity, your credentialed staff, you must have a lifeguard supervisor who is 18 and older, and your lifeguards protecting the waterfront area. There must be a swimmer assessment and buddy checks conducted every 10 minutes. You should have a written lost swimmer plan and procedures. All of the waterfront activities are identified under 9.2. In regards to instructional swim for on-site waterfront activities, one lifeguard and two adults, or one adult lifeguard and 2 counselors shall be on duty at all times during the instructional swimming. When there are 30 or fewer campers in the water. When there are more than 30 campers, 1 additional lifeguard for every additional count of 30 campers is required. For open swim, a lifeguard supervisor and 1 lifeguard shall be on duty during non-instructional swimming when there are 30 or fewer campers in the water. As it relates to watercraft activities like boating or kayaking, occupants must be supplied a personal flotation device, a lifeguard in a boat or in a rescue craft, with another adult observing the watercraft activity from a vantage point on the shore for the supervision of boating on lakes, tidal waters, or ponds. The lifeguard or rescue craft shall be equipped with a rescue ring and similar device, which is attached to a minimum of 25 feet of rope. As it relates to waterfront activities off-site the youth camp, camps must ensure that off-site waterfront activities are conducted at regulated public recreational bathing facilities. Any on-site activities, any waterfront activities, period, at a youth camp have to be conducted at a licensed or regulated recreational bathing facility. If you have an on-site facility, you should have your local health department who conducts the public recreational bathing inspection come and inspect your waterfront activities. So again, offsite activities, operators must contact their public recreational bathing facility prior to attending. And they're also required to maintain supervision ratios required by the rule of the age groups attending the waterfront activities offsite. You folks who take your campers off sites should also do swimmer assessments so you know where the ability of the child or the camper in the waterfront. Buddy checks must be done at least every 10 minutes. You also want to make sure that your campers have distinguishing apparel, whether it's a hat, wristband, shirt, something so you know which children or campers are part of your camp group. Lastly, you must have a written lost swimmer plan and procedures for identifying lost swimmers and retrieving them. Another set of frequently asked questions. Is sprinkler play considered a waterfront activity? The answer is no. Waterfront activities are when you are submerged in water. Anything from a couple of inches to feet can be an area where a person can drown. Sprinkler play would not be considered waterfront. Can I use a baby or blow-up pool in my camp activities? No. Blow-up pools or baby pools are not allowed and are not public recreational bathing facilities. Again, any bathing activities have to be conducted in regulated public recreational bathing facilities. So no, you cannot use your blow-up or baby pool for your camp activities. If I transport my campers in a minivan, do I need to have a CDL? Yes. Any automobile or any transportation conveyance, the driver must have a CDL. I know of a camp down the street, across the park serving kids and they don't follow these rules, what can I do? You can report them. Our website has a report button available on our website. Please contact us if you see unapproved or unlicensed activities out there happening in the wild. So we do have a few partnerships. We partner with our internal state partners like the Department of Human Services, the Department of Children and Families, the Department of Environmental Protection, and others to provide services and work collectively for the good of New Jerseyans. That said, the New Jersey Department of Environmental Protection realized that our globe is warming. In order to help our youth camps in New Jersey identify heat hub locations, which would be cooling stations, they developed the Chill Out New Jersey website. The Chill Out New Jersey website is an awesome tool to help New Jersey residents stay safe. It's available to all New Jersey residents. The page is also mobile friendly, but the tool allows users to easily find nearby locations where they can cool off and get relief from the extreme heat. I'll also drop this link in the chat. Our partners at the New Jersey Department of Human Services, Division of Family Development, presented earlier this morning talking about their subsidy program that is run under the Child Care Development Block Grant. If you have questions or want to participate in the Child Care Development Block Grant subsidy program, you will have to reach out to the Division of Family Development at www.childcarenewjersey.gov. Again, here is their information. And that concludes my presentation on the Youth Camp Safety Standards 2025. Let's see. All right. Looks like we're finishing right on time. I can answer some questions. I just want to lean on my earlier participants, our presenters. If you guys have any questions, Cynthia, do you guys have any questions you want to answer out loud for our audience today?
Let me check, because I did answer some personally to the participants. So let me look through and see if anyone that I want to just maybe think that would be something that the whole group would be interested in.
Okay.
I do know there was a question about schools who already take, or facilities who already have background checks. Would these background checks apply to ours? And no, they would have to take the specific CCDBG background checks for our program. Yeah, that was one of the questions. And I think we already addressed that none of the NJCCIS profiles are active. We are waiting, and we'll send an email blast out to the youth camps once the profiles are active in NJCCIS. So just make sure We'll be using the information, Danielle, that you give us from the youth camp application, as well as the email addresses that are listed in NJCCIS. So, yeah.
Okay, makes sense.
Mhm.
Cynthia, there's a
one thing.
question that
Oh,
just.
go ahead.
Oh, I'm
Go
sorry.
ahead, Tyler.
I'm
ahead.
sorry, go ahead,
There's a
Tyler.
question that just popped into the chat regarding the training sessions for us. And the question is from Tara Spire, I believe. Sorry if I mispronounced your last name. It says, in regard to the 4Cs requirements, do all staff, including 16 and 17-year-olds, need to do the 10-hour training session?
Yes, so that's nothing new. That has always been a requirement. Any staff or volunteers, regardless of their age, would have to complete the training and have to be associated to your record. That was always the process. Okay? Yes.
Okay. I'm not sure if Michelle or Nicole are still on the line. If you had any questions that have been addressed to you that you want to address on out loud. They might not still be here. So, as far as for me, I am just now looking through the questions, and one of the questions is, are dance, visual arts, and theater arts considered high-risk activities? If not, can one still apply for subsidy? So what we've done over the last couple of years, again, we partner with the Department of Human Services. We believe in the vision and to make childcare affordable for organizations that typically would not have a high risk activity. Because the subsidy program requires that these organizations be licensed, we do issue a license if you are applying to meet the requirement of being a licensed entity to receive subsidy money. And I hope that makes sense. Cynthia, did that sound crazy or did it sound confusing?
No.
Okay.
So, yeah, so I don't, we don't determine who gets the youth camp certificate.
Right.
So I think we need to kind of separate that. When you have a youth camp certificate, ours is a separate process where we determine if you can participate in NJCCAP funding.
Makes sense.
Yeah.
So again, it's we often get confused for the same
Yeah.
entity.
Yeah. So it's a two-step process, just
right.
to put it that way. Yeah.
Thanks, Cynthia. So again, if you traditionally would not be considered to have a high risk activity, but you want to be licensed because you want subsidy funding, we do go ahead and issue a license so that you can participate with the subsidy program, offering more variety to our parents in New Jersey for care options. One question that we often get is, if I run a STEM program, science, technology, I'm not sure what E stands for. If you run a STEM program, does that qualify as a high risk activity? And it depends. So if, let's say your STEM program, you guys conduct an activity like creating volcanoes or do some chemical reaction, again, that will be considered high risk because the possibility or probability of injury exists. So you would want to apply for the youth camp safety license. Bernie with the DFD. I saw your hand up, but I don't see you anymore. So if you are still on the line, let's see. I don't know if you can.
We got one question in, Danielle. This is referring to a training. So Miss Walker said, I took the 10-hour course in October 2024. Do I need to complete the course again, or do I just need the refresher course? Yes, you need to do the refresher course. So the refresher course is 2 hours, and then you have to do another additional 2 hours of training to meet the 4 hours of refresher training. Only new staff take the 10-hour course. So I know, we had repeat, confusion where staff was going back and taking the 10-hour course again. You do not. That is a one time. After that, you need to take refresher course.
Okay. Renitra, I think I unmuted you if you have any questions.
Oh, thank you. I was typing fast, Danielle.
I appreciate you.
I was typing fast. Hi, everybody. Good afternoon. My name is Bernitria Robinson, but everybody knows me as Bernie. And I just wanted to chime in on what Danielle and Cynthia were awesomely responding in terms of the question about eligibility, just requirements for the child care assistance program in order to receive subsidy. Danielle is absolutely correct in terms of, and Cynthia as well, in terms of obtaining your licensing from Danielle's side of the house is one thing, but then of course also our requirements for child care assistance program is another. And so if you have those type of questions about eligibility, would my type of program be eligible to receive CCAP funding, please reach out to us directly so that way we can review your program with you, and we can certainly reply back to you. So Tyler, if you're able to put in the chat box just the email address for the youth camps, and so because I think there was a question about a dance school or something like that. So if you could put that email address in there, and so that way we can review your program and just get back to you on it for sure. Thank you, Danielle.
Absolutely. Thanks.
All right.
Okay. With that, we really have reached the end of our training. I would really appreciate if we can get some feedback. Let me share my screen. Let me stop sharing this screen and share the other one. Yeah, we're always trying to make these presentations better for you. So if you have any feedback, I have this feedback survey. Please, scan this QR code and complete the feedback survey, letting us know what you like, what you didn't like, how we can improve, what information you want to hear that you didn't hear. And again, I appreciate you. Have a great day, and we look forward to working with you in your youth camp community very soon.